I thank the chairman for yielding and Mr. Pitts for the hearing. And yes, I've worked with Congressman Marino. 4069 is a piece of legislation that we put some effort into to come up with the Ensuring Patient Access and Effective Drug Enforcement Act. And there is a necessity to clarify a couple of definitions and provide some certainty and some consistency. We'll talk more about that. And Mr. Chairman, I would like to submit my full statement to the record.
Without
and then
objection,
also
sure.
3 letters of support for our legislation, one from FedEx, another National Association of Chain Drugstores, and then also the Alliance to Prevent Abuse of Medications.
Without objection, so ordered.
And I appreciate that so much. Congressman Marino and I are working to clarify the 2 phrases, consistent with public health and safety, and how that corresponds to substantial relationship to preventing diversion and abuse of controlled substances, and further define imminent danger by providing clarification and harmonizing the CSA with other statutes using the imminent danger standards such as the Federal Mine Safety and Health Act. And these definitions do matter. We all realize that. We're also interested in moving forward with the Prescription Drug Abuse Working Group, which would give government, public policy, and industry the ability to collaborate and provide recommendations to Congress on initiatives to reduce prescription drug diversion and abuse. This is an issue that has grown to epidemic proportions in our country, and we had about 27,000 unintentional drug overdose deaths which occurred in the U.S. during 2007, and a number that has increased 5-fold since 1990. At this time, I yield the balance of my time to Mr. Whitfield. Thank you so very much, and I appreciate that both of you are here. And have just a couple of questions I want us to be able to move on so we can get to the second panel. Continuing along kind of with the line that Mr. Pallone was going, I think that when we look at the DEA and look at what is happening with prescription drugs, you know, you can look at the laws are very clear when it comes to the illegal drug trade. You know that distribution of heroin or the methamphetamines, you know, it's illegal. That type clarity is very helpful in enforcing the law, but when we are talking about the pharmaceutical products, what constitutes legal prescribing and dispensing is not quite as clear. So let me just ask you if you can list for us what you are doing, articulate what the efforts are that the DEA is engaged in to promulgate some clear standards for the prescribers, for the pharmacies, for the distributors. What is your step-by-step? You say you've got an MOA. You say that is pending. So give me your tick list.
Well, let's talk about the prescribers first. I believe that the courts have settled what a prescriber must do. He must issue a prescription, a controlled substance prescription for a legitimate medical purpose in the usual course of professional practice. That was given to us by U.S. v. Moore in 1975, and that hasn't changed. That's very obvious. When we go out and talk to physicians groups, we tell them that's their standard. They know that's the standard. If you looked back when we were doing the internet pharmacy debacle, when doctors weren't seeing patients, they were just writing prescriptions without seeing the patient and having a pharmacy over the internet fill them, that was not for legitimate medical purpose, not in the usual course of professional practice. There was no established doctor-patient relationship. Now let's talk about the pharmacists. The pharmacists have a corresponding responsibility to ensure the prescription is valid. We go out and we teach the pharmacists, as does the National Association of Boards of Pharmacy and the particular pharmacy boards that that pharmacist sits in, that they have a corresponding responsibility to ensure that that prescription is valid, that is issued for a legitimate medical purpose in the usual course of professional practice. Pharmacists understand that. There's a transparency in the case law, there's transparency in how we do things. We've done prescription drug pharmacy diversion awareness conferences, and I think 4 states.
Okay, well, a lot of that we know. We were looking for a little bit of new information, and I guess it's kind of a Monday attitude sort of day. So let me move on.
Well, I'd like to finish
what are
about
you doing
distributors.
to help
I guess
well-intentioned registrants determine who they can do business with?
I'm sorry? The registrants determine who, we don't dictate who the registrant does the business with.
Okay. I thought maybe you were doing a little bit to help them
Well,
with
we
who
are,
they can.
if I could proceed with the wholesalers and distributors, besides having one-on-one contact with the wholesalers and distributors in the distributor initiative, telling them what to look for and what red flags to look for, or our yearly conference with the distributors as a whole to talk to them about what red flags, what we're seeing trend-wise and what they need to look for. Besides the on-site investigations that we do, the cyclical investigations to determine compliance and to assist them in complying, you know, besides the fact that they call in and request assistance.
Okay, well, let me move
questions.
on then,
I mean,
if it's laborious.
I think
so let
we
me
were
go
taking
ahead
off
with
this. It's not laborious. You asked me to
I
take off
did.
what I'm doing, and 16,651 people in 2010 died of opiate overdose. Okay, opiate-associated overdose. This is not a game. We're not playing a game here.
Nobody is saying it is a game, sir. We're just trying to craft some legislation. Let me ask you this.
Especially in Tennessee.
Your
there's
written
340
statement indicates that the DEA has initiated less than 20 administrative cases in the last 6 months. What is behind the significant decline in case initiation, and are you satisfied with the number of cases being initiated?
Well, we're initiating cases, for sure. Our case numbers have not gone down.
I think the case numbers have gone down. Okay, if DEA has only initiated 20 administrative cases in the last 6 months, what is DEA doing to help registrants identify the prescribers and pharmacies that they should refuse to do business with?
Well, ma'am, that's a due process issue. We can't direct a wholesaler or a distributor or a pharmacy not to sell to a particular person. They're afforded due process like every other person. So if I told them, hey, don't sell to this pharmacy, don't sell to this doctor, then they wouldn't be afforded due process.
Okay,
That's
my
what the
time
order
has
show.
expired. I yield back. Thank you so much. And I want to stay with Mr. Gray and follow on with Mr. Green's question right there, because Mr. Ranazizi said several times, you know, DEA doesn't have quotas for the distributors. So it's up to the distributors to basically model how they are going to interact with the pharmacies on this product. So looking at the answer you just gave, is there anything else you would add into how these distributors are modeling their activity on the distribution of these drugs? And then I'd like for you to talk for just a second about why this is problematic for our smaller pharmacies.
Well, let's go back on that storyline we were just talking about. When our members submit their suspicious orders on a weekly basis, DEA collects that data. They collect data from all wholesalers. So they imagine it as a piece of a pie. They see a pharmacy as a piece of pie. They'll see the 360 degrees of that piece of pie. They see everything going in the door of that pharmacy with respect to Schedule II drugs. The particular distributor who DEA may be questioning, and you can correct me if I'm wrong on this, Lyndon, but the DEA sees the whole picture. That particular distributor sees only their slice of the pie. They do not see what other distributors are doing. So
let me ask you, would it be helpful then if the DEA were to periodically give a report back to those distributors as to where they are seeing patterns that are troublesome? And Mr. Barber, you may want to weigh in on this, since you basically were involved in taking action against that supply chain.
It would certainly help, because I know in many cases, talking to my members, is that they will approach the regional office of DEA and say, we've got a pharmacy here, Pharmacy X. Pharmacy X to us has suddenly seen an increase in ordering. This is out of their normal historical trend. Mr. DEA agent or Mrs. DEA agent, should we cut that pharmacy off? And the answer most typically back is, well, that is a business decision the wholesaler needs to make on their own. And then we'll essentially fundamentally let you know if you were wrong after the fact. So you're right. He was right. There are no quotas. But again, that creates the conundrum and the problem because not having quotas gives the DEA the flexibility to take enforcement action, I think, without any kind of clarity for the wholesalers to whether or not they're making the right business decision in terminating that pharmacy. Well, Linda, I don't know if you have a different opinion.
Ms. Blackburn, I've looked at some of the DEA information that they've provided to industry. One of the things that we hear over and over again from the agency is there's an average number of pills that a pharmacy uses, but a pharmacy that fills 50 prescriptions a day uses a lot less drugs than a pharmacy that fills 500 prescriptions a day. And being above average is meaningless because if you have a normal distribution curve, half of your customers are going to be above average. And so it would be very helpful to industry if there was trending and modeling done not just by the industry but by the agency who has all of the information.
Okay. You, Mr. Barber, in your testimony, you focused a little bit on the importance of clarity of the law. And are there some specific areas that you think we should highlight in working with the DEA on how they should be more clear with the registrants?
Certainly, and I think your bill takes a great first step in creating the environment that is necessary by clarifying what imminent danger means and what consistent with the public health and safety means. At an industry conference recently, a DEA official told the industry that it means whatever DEA says it does, and that's not really helpful when you're trying to comply with the law. There are other areas where I believe that oversight can be helpful, particularly in the regulatory environment. The agency will talk about things like due diligence by distributors on customers, and yet you won't find the term due diligence anywhere in DEA's regulation. And so areas like that require clarification and notice and comment rulemaking because it is those types of initiatives that actually will prevent prescription drug abuse.
Thank you. I yield back.